Namaskar, parents. I'm Dr. Pooja Singh. I'm a psychiatrist practicing in Kalyan, Maharashtra. I am practicing and working with children with special needs for the last 7 years. I have another channel on YouTube by the name of Shakti Kalyan, which is which has videos catering to the needs of these children, but most of these videos are in Hindi. So now we have started this where the videos will be in the English language for the English speaking parents. The aim is to give tips to help parents deal with their children who have special needs. So this is my first video in English, which is about the GFCFSF diet in autism. The gluten-free, casein-free, sugar-free diet is highly practiced by parents themselves. They are trying this on their children, right? Now, all this gluten and casein. Gluten is a protein that we get in wheat, but we do not get it in wheat alone. It is there in wheat, it is there in processed flour, what we call maida in Hindi. It is there in broken wheat, in barley, in rye, in hing. Hing is asafoetida in English. This also has gluten. Apart from these edible products, there are certain chemicals, certain cosmetics like talcum powder, lipsticks, nail polish, certain paints. These too have gluten. Oats, when produced in the natural form, doesn't have gluten, but when it is processed, there is cross contamination with other grains, and that results in oats also having gluten. Okay. Certain medicines, certain antibiotics have gluten. So it is not limited to only our edibles. Cosmetics, medicines, paints also have gluten. I have a girl in my class suffering from autism who, when exposed to talcum powder, I can see a change in her behavior. Her hyperactivity levels increase drastically the day she applies talcum powder. So the mother has to keep that also hidden, right? So these are products with gluten in it. Then there is casein. Casein is milk and milk products. All milk products have casein in it. Milk products like curd, buttermilk, cheese, paneer. Paneer is cottage cheese, butter, ghee. These too have casein in it, right? Now and sugars. Sugars are everything that is sweet, whether it be sugar, whether it be jaggery, whether it be honey, all of it. Now there is this hypothesis that GFCF diet is very effective in reducing the hyperactivity levels, aggression, sleep issues, and gut issues in children with autism. Now the science behind it is that gluten as well as sugars in children with autism, they increase the inflammation in the intestines, because of which the intestines become more permeable than what they are supposed to be. We call it a leaky gut. Due to that, it starts absorbing exorphins, and exorphins are basically opioid-like substances that then start entering our blood. Normally they should not. right? They need to be thrown out. But in this case, in children with autism, because of gluten and sugars, the intestine starts absorbing these opioid-like substances, resulting in behavioral problems, hyperactivity, very much increase in sensory issues, sleep issues, and gut issues like constipation, diarrhea, bloating, right? The same is for casein. Casein, when we have milk, casein goes into the stomach, mixes with the acid in the stomach, and again causes release of these opioid-like substances. Again, the same problems. Because of this scientific reason, this hypothesis has been made that the GFCFSF diet is effective in controlling certain symptoms of autism. But please understand that this is just a hypothesis. It is not the mainline treatment, and it is not equally effective for all children in autism. Some children may benefit, some may not. Understand this also, right? Especially for the GFCF. It is not the same for all children. SF, sugar-free, yes. Sugar-free diet is applicable to all children, including normal children. Even they should have a sugar-free diet. Okay. As per a few RCTs, randomized controlled trials, the GFCF diet does not in any way improve the core symptoms of autism. Then what does it improve? What should you expect? You can expect that following a GFCF diet, the child should be calm, his hyperactivity levels should reduce, aggression should reduce. If there are sleep issues, they should reduce. And if there are gut issues like constipation, diarrhea, bloating, then there should be some relief in these symptoms. This is what you are targeting. Okay? Now, when we say GF, gluten-free, casein-free, we have to remove gluten and casein from the child's diet. But if you come to see, our main diet is that. There is wheat and wheat products. There is bread and bun and different types of rolls, different types of yogurts and curds and milk. This is what makes up a child's main diet. So we can't just free the child of it, right? We have to properly substitute it. Okay? Gradually and properly. So the entire calorie content that the child is getting from gluten and casein has to be properly replaced by other alternatives, other substitutes. Then only it is effective. I have two kids who lost 3 to 5 kgs in 2 months following GFCF diet because it was not the food was not properly replaced, the calorie content was not properly replaced. The child lost weight, the child lost energy to do therapy, to do work, to move around. The child became so weak because the GFCF was not done properly. Okay, parents? So please consult a dietitian, consult a nutritionist. They are the right people to give you this diet. They will properly calculate your child's calorie intake, energy intake, and replace it with the correct quantity of other alternatives. Okay? So do it properly and do it gradually. Today the child is eating gluten and tomorrow he is gluten free. That is not how it is done. Okay? And it should be slowly replaced over a period of maybe 15 days to 1 month. It should be slowly replaced. And while replacing, make sure that there is no cross contamination. Right? For example, if you have um, you're using a pan on which you have just made wheat chapatis or wheat rotis, and you now use the same pan to make roti out of jawari or rice. So there is that wheat flour on that pan. Okay. So you have to clean it, remove that wheat from the pan and then use it. Otherwise, again, there is cross contamination. So it needs to be done very properly and gradually. And while doing it, like you have put your child properly on a GFCF diet. If you do not see any changes in these symptoms that I've just mentioned, hyperactivity levels, aggression, sleep issues, gut issues, if there is no change in them in the next 3 to 6 months, you can slowly go back to gluten. Okay? It is not equally effective for all children of autism. Please understand this. Right? It comes under GFCF, comes under CAM, complementary and alternative medicine. Okay? So it may not be equally effective for all children. Okay. So the end line that I want to say before I finish this video is that do GFCF after consulting a dietitian or a nutritionist. Sugar free, SF, you can practice from today, not only for children with autism but for all children. Okay. And if you are following this GFCF diet, do let me know in the feedback as to how effective it was for your children. Right, parents? So please watch our video, like it, share it, subscribe to our channel, and let the Shakti spread. Vijay Bhava Tatha Astu. Namaskar.